with Shalom. He is working in a New York hospital, Mount Sinai, I believe, right, Shalom? Would you please introduce yourself?
Hi, my name is Shalom. I'm a registered nurse working at Mount Sinai Beth Israel in the city, in New York City. And I'm currently on the front lines taking care of COVID patients.
Yes, I've been chatting with you a little bit on social media throughout the last couple of weeks, and I have really been interested in getting you on a call to chat about some of what we hear is going on in New York through the media, because as you know, I'm in Toronto, and a lot of us around the United States and in Canada, we're hearing about New York and dire circumstances right now with a huge number of infected people with COVID-19. And you're there and you're working in the hospital. And it's important for me to share stories of healthcare workers who are actually dealing with this so that we can maybe get some questions answered and set the record straight on a few things. So I wanted to ask you, first of all, what have you seen progressing or changing over the last couple of weeks? It's now April 5th.
Well, it started off with one unit opening up, patients coming in, respiratory distress, other underlying conditions. And over the past couple of weeks, we've definitely seen an increase in the amount of patients coming to the hospital, the amount of underlying conditions ranging from absolutely nothing to, a whole slew. And it's just been progressing at a rate that we're not used to. I guess you can say we've been opening, in my house, we opened up 3 or 4 units, until, we're trying to, kind of maintain the ratios between the nurses. But, at some point, there's just a lot of patients that just need somewhere to be.
Right. And when you say that we're not used to, let's clarify that in comparison with the flu, yearly flu, which we all know does take a number of lives every year, huge
for
numbers.
Sure.
So there are similarities with this, and there are also some differences. How would you say that you are finding this presents differently and is affecting your hospital differently?
One of the biggest things they say is different between this and the flu is that it stays on surfaces 3 times as longer, which increases the amount of transmission. So with the flu, you can be sick, for a couple of days, and get over it. Here, it's staying. It's much longer in your body, and then it transmits to other people much quicker. So that's one of the big differences we notice, that it's much faster in transmission.
And we're hearing as well that there are a lot of people walking around carrying this and unaware of it. They're not necessarily manifesting symptoms.
Yeah, you sometimes would not see or feel symptomatic. Some people have very mild symptoms. Some people have very strong symptoms. It's still, again, this is so novel that it's still being discussed and trying to research, and why it plays differently in other people. It was told that, only if you have underlying conditions. We're seeing that now it's not the case. We're seeing that it's causing cardiac issues as opposed to just respiratory issues. We're seeing that, perfectly healthy people could be getting it and, spiraling downwards in a matter of days. And some people get it and they are perfectly fine.
So I don't want to put you on the spot with that, but I am curious to hear what your take is. What is your perception of the percentage of patients who don't have underlying health issues? So somebody in their 30s or 40s, and they're not a smoker and they don't have a heart problem, but they get this and die. Is that happening a lot? Is it surprising?
It is happening. It is surprising. Again, I can only speak from my experiences, because just like you, there's a lot of hospitals and there's a lot of different, providers with a lot of different statistics, and every person turns out differently. So I can't speak for, New York in general, or, but from my experiences, I haven't really experienced, patients really like spiraling down very quickly. But from the people I've spoke to who are really taking care of these sick patients. It is happening a lot more. They are seeing more with men than with women.
Yes.
But the original age gap with like over 60
Yeah.
is not as prevalent. We're seeing a lot more younger in the 50s and even 40s.
Yeah.
Young people with no medical history or slight, even if it was a little bit of asthma, something that we wouldn't think.
Which so many people have that, and it
Right,
doesn't pose a
yeah.
problem in their
Right.
daily
We don't
life at
think that
all.
it all causes a problem, or even if you're a little overweight,
Yeah.
they see that it's happening a lot with diabetics. Something with the sugar. Again, there's not a lot of studies. So the hospital, we're focused on trying to take care of them, trying to
Yeah.
figure out what it is and get them out of the hospital.
So that would tell me as well, given the diversity of the patients that you're treating, that your treatment protocols are going to differ as well, and the variety of medications that are being tried right now, the combinations are different for everyone. So are you taking it on a case by case basis as far as the treatment protocols?
Yes and no. For the most part, we're starting with hydroxychloroquine and azithromycin combination. Usually, from my experience, is that we give the azithromycin more if it's like a viral bacterial pneumonia. I think if the patients are exhibiting some of that, then the azithromycin seems to help with that more. Everyone is on Planaquil because that seems like the go-to medication. They are now in my hospital, in the Mount Sinai system, they're starting with the plasmapheresis, which is, transfusions of plasma with people who've actually overcome and are supposedly have the antibodies.
Right. Yeah, I've been hearing about that.
So I think it's, I think at some point we're trying our best, to help every patient individually, but there's that overall protocol that we're using that seems like it works. Again, there's not a lot of studies as time goes on and patients are recovering because unfortunately the media doesn't really record as many people recovering as people getting it.
Of course, yes.
So
and there are lots. So
there
you are
are
seeing what works and you're able to
right.
repeat that. And
Exactly.
yeah.
We do see that it does, there are positive outcomes. So
Okay.
we're keeping, grinding and at the end of the day, we're trying to get the patients to breathe on their own and not have to use supplemental oxygen.
Okay, great. So the other part of this that I want to ask about, because it's really the human side, is that our healthcare providers and even other frontline workers, emergency, police, fire, paramedics, certainly nurses right now, you all have families, you have lives, you have to function and take care of the people that you love as well and go home and be safe. And with something that has been discussed as so infectious and so easy to spread, and we're hearing about unfortunate stories of doctors and nurses dying as well, what is the concern like for you as you go to work in this environment every day, but you have to take care of yourself from an infection control standpoint, but then also your mental and emotional health as you deal with this and go back and forth in your life?
Yeah.
What are you doing?
It definitely plays a toll. Emotionally, it's hard. It's especially harder when you start hearing of cases of people who or people who know, and it gets closer to home, and you think like, I voluntarily or whatever go into an environment where there is this virus and working, and then I have to come home to my kids, to my family. It's not easy. But at some point we just got to be, strong, and be safe. So I can talk to my practice. I usually bring a change of clothing to the hospital. I usually went after my shift, change out of my clothes, wipe everything down. And then when I come home, I jump straight into the shower. Everything goes in the wash, don't touch anything. Um, and you just gotta have some faith. There's a point where it comes to like you have to do everything within your power and understand that this is something that we're seeing is everywhere. So You can't.
Yeah, especially in New York with the numbers that you have.
Yeah.
I've been hearing that from people I know there who are also not involved with healthcare, but saying to me that they feel it's almost inevitable that they will catch this at some point.
So I believe, and this is just off what you said, I think we all are susceptible. I think either
Yeah,
most of us have gotten it or been exposed to it, or, some of us may have had it and not even realized we've had it.
sure, yeah.
So it's kind of hard to really gauge because we're not all getting tested. So because we're not all getting tested, it's hard to really say, did I have it? Did I not have it? So we all have to act like we all have it. And if we go with the mindset and just protect ourselves, and I think that's what they're trying here in New York and in other states, in other countries, treat like everyone has it. When you go
Right.
out, wear a mask, wear your gloves, wash your hands. That way, even if someone hasn't been exhibiting symptoms, or you haven't been in contact with, and you see them, like, everyone is at a point where it's unfortunate that you have to just keep that social distancing.
Can you share a little bit about that, in particular, the masks? Because I've been hearing some confusion, and I don't know if it's a controversy, but certainly confusion for people over whether it's useful or not to wear a cloth mask, a homemade mask, a surgical mask, as opposed to the N95s. What's the difference? And from your perspective, what's useful or not useful for people to do?
Right. So, as I heard, someone told me something is better than nothing.
Yeah.
So the cloth masks, and I've seen on social media and beyond people coming up with very innovative ways how to create a respirator with different cloth and other
Sure.
materials, and that's great. But unfortunately, in the hospital, there's the CDC guideline and we have the FDA guidelines, so we have to really obey by them.
Yeah.
So we are, using the N95s and surgical masks on top of that. But everyone has to do what they can. There is a shortage, and
Yeah.
unfortunately, the healthcare workers do need N95s.
Yeah, definitely. So for the average person who's not entering a hospital and they're just going to the grocery store, wearing a cloth mask for them, or one of those little surgical masks that are not N95, is still useful because potentially they can prevent spreading their own
Yeah,
droplets,
yeah.
and
Part
yeah,
of it
it's
is protecting yourself and protecting others.
exactly right. And they're not working directly in prolonged contact with patients, so they don't need an N95 per se. That makes sense. Okay, so it sounds like you're holding up pretty well
Yeah.
under an incredible amount of stress. I'm really glad to hear that. Do you have any optimism at this point in an environment where we're being told there's still a surge coming, there's still potentially more
You just
negative
gotta, yeah,
coming?
you just have to really stay strong. People are recovering, people are managing.
Yeah,
Um, so it's not everyone is dying. A lot of people are recovering, and it's something that's gonna end. It's not something that's gonna stay. And the longer this goes on, the more research we have, the more information we have about what's going on, and the treatments are going to change, and hopefully we'll get past
yeah.
this pretty quickly.
I'm finding it really encouraging to hear how much research is being done and innovation and really great discoveries. Unfortunately, like you said earlier, they aren't shared as much in the media. So the people
Right,
recovering, the treatments that are working, and the really cool innovations that are coming out of this, it's
right.
happening. I'm glad that you feel that way, because if anyone had a right to feel overwhelmed and pretty negative at the moment, it would be you. So if
Yeah,
you're
it's very overwhelming. It really is. You just gotta keep with the grind. We've been seeing a lot of people coming out and showing support, which is really, really, really helpful. It really does. Even though we don't respond right away, just to know that everyone's thinking about you.
yeah,
And it's unfortunate that we have to get to a pandemic. I actually had a post about this to make us realize, but it's something that we are working hard. And we're trying our best to keep our patients safe.
I'm so glad that you are feeling that love. I know a lot of people are trying to send that out to you and appreciate what you're doing. I appreciate you talking to me. I know you're really busy, so I will let you go. And thank you so much for giving us a firsthand update. And
Of
please
course.
be well, be healthy, be safe.
Thank you. You too. Stay safe. And as someone always told me, stay sane.
Ah, yes, very important. Thank you.
Yes.
Bye.
Bye.